Everybody, it's Ashley, associate pediatric emergency mom. Happy Tuesday. Yeah, it's Tuesday. Happy Tuesday. Today we were going to talk about cough. Someone had asked about coughing and cough medicines, and I'd done a live on this last year at some point, but I thought, well, you know what, let's go ahead and tackle it again because it's such a good topic. And I really enjoy talking to families about cough in the ER. We do have two guests today, Archie and Lucy, and they've been sleeping for the last 2 hours. I know now they're awake, typical, just because I'm doing this. But we will hope that they cooperate, I hope. Okay, so I think I figured this out, that I can share the screen. And so you guys know I like to do my simple drawings. And so I've figured out a way to incorporate my simple drawings into the cough discussion. Okay, so here are my super simple lungs that I drew, I think, last year. So, and this talk on cough, I do want to just add, this talk on cough is about kids, kids who have been sick. So they've had some runny nose, maybe a little fever, and then they've started coughing. This is not for the kids, like the toddlers who are playing with a little toy and then abruptly start coughing, or the toddler who's eating popcorn and has a choking episode and abruptly starts coughing, gagging, vomiting. Then we want to think about foreign bodies. So this is cough when related to illness. Okay, so here's my lung. So let's just, inside the lung, why do we cough? What's going on in the lung? So the lung is lined, I don't know if y'all can see these guys. The lung is lined by ciliated cells. So it's cells with little fine hairs on them. And so those cells are always working to move mucus out. And that may come in the form of dust particles, allergens, or mucus produced by the body trying to get rid of a virus. So those little hairs work that mucus out, and then it kind of hits the back of our throat, and that's what stimulates us to cough. So in those kids that are sick and are coughing, I always tell parents, I want them to cough, right? I want them to get that mucus out. So that's, you can see, here's my green mucus, but that mucus might be white, it might be green, it might be a little bit darker, all kinds of colors. So this is called the mucociliary escalator, which is a super fun thing to say, mucociliary escalator. So you can see these guys are my little ciliated cells that I had in the previous slide. And then here, there's a lot of mucus, but these globs are the mucus. And so the lungs work it up into, from the main stem bronchi, right? Those big tubes, up through the trachea and out. And y'all please feel free, ask questions throughout, type questions, and I'm happy to answer them. And so this is why it's important that we allow the cough to happen. I mean, sometimes it interrupts sleep, and as parents, we hate to hear our kids coughing, but it really is, in the setting of illness, it is good for them to cough and get that junk out. I also wanted to talk a little bit about wheezing and cough related to wheezing, and again, related to illness. This and then the next two pictures are things I draw for families quite a bit in the ER, and not sophisticated drawings. Like I take a paper towel out and draw it and sketch it out and to explain to families. So why do kids wheeze? Most of the time, just general kind of tip of the iceberg discussion, kids are wheezing because they're either having bronchospasm, like asthma, or because they have a lot of mucus in their airway. So bronchiolitis, RSV, respiratory syncytial virus causes bronchiolitis, but any virus can cause bronchiolitis. You get this mucus in the airway, and if it's clogging up a lot of the airway, it can sound like wheezing. Now, asthma on the other hand, the airway shrinks down. So let me show you what I'm talking about. I'm going to come to this one first because it's simpler. So if you take a cross section of the airway, so if I just cut like, let's say I cut my right main stem bronchus right through it. So here's the airway. If I'm wheezing because of asthma, I'm going to have bronchoconstriction. So my airway that's normal size is going to squeeze down to this little tiny size. And if I take albuterol, right, that bronchodilator, then it's going to dilate back out to normal size. If a baby, for example, is wheezing because of bronchiolitis, the size of the airway is normal. See this black circle, the outer black circle? That's a normal sized airway. So it's not that the airway shrunk down, it's that there's so much mucus in here that the lumen, like the effective size of the airway, is smaller, and that's what makes them sound like they're wheezing, And so here's another, just another detailed picture. So the cross section of the airway, mucus in the airway, and so what do we do to help with this? Well, we want the kids to cough and then suctioning, like the nasal suctioning for the babies. And then for asthma or reactive airway, we're given that albuterol to dilate out their airways. Okay, so those are my super sophisticated drawings. And then let's, since we're talking about illness and cough, let's throw croup in there too, right? So with croup, you have a viral process, you have parainfluenza. Last year we saw a lot of coronavirus in croup, not COVID-19, not the novel coronavirus, but the regular coronavirus strains we had been seeing for years and years. That triggers a little inflammation of the upper airway. I just need y'all to know that she kisses him, he growls and bares his teeth, and she licks his teeth, and the cycle continues. So that virus triggers some inflammation of the upper airway. And then you get a little narrowing kind of under the vocal cords. And so that's when you get that middle of the night, that kind of terrifying noise that your kid will make. They'll sound hoarse. They'll have that barking cough. And it's really scary, especially if it's happening in the middle of the night. When we look at the x-ray, this is a trick I tell the residents. The trachea up here in the upper airway normally should look like a red wine bottle, but in croup, it starts to look like a white wine bottle, and it has what's called steeple sign, that more tapering effect. Okay, so cough is good. We want that mucus to come out. So why, in the name of all that is good, do we walk into the cold medicine aisle at the pharmacy and see just this sea of confusion? What the heck is all of this stuff? So this overlaps. It overlaps a little bit between cough, between fever, sneezing, runny nose, all of those things. Because when we're talking about cold medicines, we have to consider the whole overwhelming cold aisle. Okay, and again, y'all just ask questions, type out questions anytime. So I drew this up, I think last year. When you look at a box of medicine or a bottle of medicine, they're giving you the name, they're giving you the symptoms treated, they're giving you the medicine name, whether it's acetaminophen or guaifenesin, and we'll talk about those. And then they're telling you what symptom is treated. Sorry, I don't know why it's doing this. What symptom is treated with that medication. And then they're telling you the symptoms treated again. So the box is like, you can ignore most of what's on that box, right? Really, the main thing you need to know is this, the medication and what symptoms it's treating. On the back, it'll give you the drug facts. So most of the time it's, if it's a liquid, it's the milligrams per teaspoon or per 2 teaspoons. So per 5 milliliter or 10 milliliter. And then I have 20 on here. And then the uses and then the warnings. So again, like this, a lot of this information is on the front of the box. So we go down the cold medicine aisle and we're overwhelmed. And I've I've watched more than one parent have a meltdown in the cold medicine aisle as I'm trying to get like Tylenol or something for the kids. So what are we trying to treat? And this kind of reads like a clock. So starting here and then going clockwise. So pain and fever, Tylenol is your component for that, or acetaminophen. For congestion, it's a decongestant. It's pseudoephedrine or phenylephrine. And if you're getting it over the counter and you're not having to show your ID, those cold medicines have phenylephrine. The pseudoephedrine cold medicines are behind the counter, right? And you have to show your ID. Because they're closely regulated now because of, unfortunately, drug manufacturing using pseudoephedrine to manufacture methamphetamines. Then, oh my, I thought I was doing so good with the technology. Okay. Allergy kind of symptoms, sneezing, itchy, watery eyes. That's when you would use your antihistamines. Diphenhydramine, brompheniramine, and then doxalamine as well, which I don't have on here. Helping with sleep, that's something that's always listed on the box for nighttime. All that is an antihistamine. So most of the time it's Benadryl. Sometimes it's one of those other antihistamines. For cough suppressant, it's dextromethorphan. So every cough medicine that you see on the shelf, you'll probably see DM next to the name of the medicine. And then for mucus, we need an expectorant, and that medication is guaifenesin. So now that we've covered that, let's just go to the cold medicine aisle, okay? And then for the purposes of simplicity, I think I did a lot of these are adult medications, right? Just tablets, which if your child is old enough and large enough, you can use the adult medications. Okay, so mucus relief. What is this? Now this one says chest congestion, mucus relief. This one says cough, mucus relief, DM. What are we doing, right? What's the difference? Well, I look at a few things. I look at what's in it. So this is guaifenesin. This is an expectorant. So this just helps to thin out the mucus so that it's easier to clear it. If you're going to take this, make sure you're drinking plenty of water because this can dry you out. So stay hydrated when you're drinking or when you're taking this. So this one has guaifenesin 400 milligrams per tablet. Now you look over here. Let's see. How do I? There you go. This one has 400 milligrams of guaifenesin per tablet, but it also has dextromethorphan 20 milligrams. So I got to tell you guys, this medication, guaifenesin, so an expectorant with a cough suppressant, is one of the medications that makes the least sense to me. I mean, you're thinning out the mucus so you can get it out, but you're suppressing your cough. It makes no sense to me. But you can see if somebody doesn't know and they're just reading this, they're getting really confused because I do have chest congestion, but I do have cough. So I need mucus relief, but this says cough. So which one do I get? It's very confusing. This medication, 30 tablets, $10.99, right? This one's a twin pack. But 30 tablets, $10.99. This one, 120 tablets, $22.99. So these are both over the counter. If you look, and I don't know if I have it, but yeah, there we go. So what did we say? This one is 120 tablets for $22.99 or 30 tablets for $10.99. So if we come over here, 14 tablets for the name brand is $20. So then you're getting into just cost. Like how much does this cost? And if the ingredients are the same, right? If you have the same medication, the same milligram, the same concentration in the generic and the name brand, I mean, you can get the generic and it's the same. Hey, Archie, this goes on all day. I mean, y'all. Shh. Okay. all day, but they were sleeping the last 2 hours. So here we get into, let's get into this. So here's some kids' cough medicine, right? So I say kids. No, sorry, it's adult, but it's the liquid. This is maximum strength. Maximum strength. What does that mean? Well, I'll tell you, I don't know how well you can see this, but what's in this one in the daytime and the nighttime is the same thing in this one, in the daytime and the nighttime. So the daytime, you have guaifenesin and dextromethorphan. So this is the same thing that was in the Mucinex, right? Mucinex is the guaifenesin. Mucinex DM is guaifenesin and dextromethorphan. So it has that cough suppressant as well. And then this one, all they're doing to give you a nighttime is adding an antihistamine. So that's all they're doing for that, to give you the nighttime. Let's see. And so then if you look, this one, Robitussin, is 4 ounces, 4 fluid ounces. And Welltussin DM Max is 8 ounces. Same concentration. This one's $12. This one's $10.49, except that this is double the volume you're getting here. So again, super, super tricky. Let me just let sister out. There you go. Oh my gosh. There you go. Oh, okay. She's a mess. Now Archie can sleep peacefully. Okay. And so let's look at the back, just so y'all know I'm not I'm telling you the truth about the concentrations. Oh, I gotta get used to doing this. Okay. A little blurry, but this says dextromethorphan 20 milligrams and guaifenesin 400 milligrams in 20 milliliters. And this is the generic, same thing, dextromethorphan 20 milligrams, guaifenesin 400 milligrams in 20 milliliters. So it's the exact same medication, right? In this one, they've added that antihistamine, though, the nighttime version. And again, the cost is the big difference in these two. So let's look at this one. Severe cold and flu. Wow. So this is like, you're not feeling a little bit bad. You're feeling really bad, I guess. So you don't want to give this to kids, right? Because it does have 10% alcohol in it. But what is in this? Tylenol, a decongestant, an antihistamine, and a cough suppressant. You got a lot of stuff going on here. A lot of stuff. The acetaminophen is for fever and pain, right? So if you're having a headache or have fever, you can do the acetaminophen. Or you can just take Tylenol or Motrin. The phenylephrine is for the sinus congestion. The doxylamine is what makes it the nighttime, right? They're just throwing an antihistamine in there. And then the dextromethorphan stops you from coughing. So again, with the cough suppressant, not something we do or we recommend in pediatrics because we want that mucus coming out. And so when we look at the ingredients of this, she wanted to get out and now she's back. In 30 milliliters, you get 650 milligrams of acetaminophen, which is a normal adult dose of Tylenol. You get 20 milligrams of dextromethorphan. Remember, that's the same thing that was in the other two formulations, right? The tablet that had the DM on it, and then that other Robitussin suspension, 20 milligrams. The doxylamine, that's the antihistamine, and then phenylephrine, which is the nasal decongestant. And so if you're taking a combo med like this at night, like theoretically it's going to make you sleepy, but I mean, you have phenylephrine can make you hyper. Some people have the opposite reaction to Benadryl, and so it might make them hyper. So it's always tricky when you do combination medications because how will your body react to this combination medication? This I think is, and I'm sorry, I didn't like prepare a formal like presentation before. I think what I was doing here is comparing it to this giant bottle that also, sorry, I forgot to say, you can always look at the top and it says compared to Vicks, NyQuil, Severe, or VapoCool active ingredients. So like this is the alternative to that medication. This is the alternative to that medication in the daytime, right? The daytime formulation. So we have Tylenol, dextromethorphan, guaifenesin, phenylephrine. So the only difference here is you have guaifenesin in this one, and then in this one, there was no guaifenesin, but there was an antihistamine. Are we confused yet? They want to confuse you, I think, but we got them now. We know what's happening. Same medication, Robitussin, 4 ounces. 4 ounces of Robitussin is $8.79. 8 ounces of the exact same thing in the generic is $9.49. No tricks. Just is what it is. So here we go. We have these two that are the same, right? We just talked about those. The severe symptoms. Acetaminophen, dextromethorphan, guaifenesin, phenylephrine, right? Pain, cough, expectorant, thin out your mucus, and decongestant. Same thing in this one. Same thing. What's this? Mucinex Fastmax. Let's zoom in. Mucinex Fastmax. What is in here? Acetaminophen, dextromethorphan, guaifenesin, phenylephrine. Oh, same thing in the generic. Okay, I got to get better at this. Let's see. Same thing in the generic. So all of these are the same. They're the same. They got to be different in some way. How are they different? Let's see. Okay, zooming in. Too much. I am the worst at technology. Okay. Acetaminophen. Here's acetaminophen, 650. Dextromethorphan, 20. Guaifenesin, 400. And that decongestant phenylephrine, 10. Okay. So that's same as the other one. And then look at this one. Acetaminophen, 650. This is the generic and this is the Mucinex. Dextromethorphan, 20. Guaifenesin, 400. Phenylephrine, 10. It's all the same, right? All the same. So what is the big difference? Let's see. Well, 8 ounces of this one is $10.99. It says 8 ounces, and then it says free 4 ounces. There's a sale on this one. That's nice. 8 ounces of this one is $9.49. Let's look at these. How many ounces? 6 ounces. This is 6. 6 ounces of this one is $11. And 6 ounces of this one is $17. When we could have gotten 8 ounces of the same for $9.49. So it's just reading labels, right? Because all of these medications, and I'll come back, all of these medications have some combination of these things in them. It's just trying to figure out what you need. And honestly, when it comes to kids, you know, just the fever meds, and if they're old enough to have an expectorant, then doing guaifenesin. And if you'd like to add an antihistamine, you can, because even though histamine is the main problem with allergies, right? We need an antihistamine because you have a histamine release when you have allergies. It does show up a little bit in colds. And so it may help. And then I wanted to just briefly talk about Zarbee's. So people, get really excited about Zarbee's. Zarbee's was actually created by a pediatrician. And we don't recommend cough suppressants, but honey is a natural cough suppressant. You should never have honey. Your baby should never have honey if you're less than a year of age, right? I think we've talked about this before. There's a risk of botulism, and so never give honey if they're less than a year of age. Um, but honey can soothe the throat, make them feel a little bit better, natural cough remedy. But what are you buying with this? You're buying the honey, and then the daytime has grapefruit seed extract. I mean, when you get into the natural medications, like it's, if you've done your research and you know where it comes from and the side effects and all of those things, great. But I can't. This is where I can't fully speak to all of the effects of grapefruit seed extract. And then the nighttime version. So Zarbee's nighttime, it has melatonin in it, which you can use in children, certainly. But if you're a parent that doesn't want to use that in your child, and you're not, reading the label, and you think, oh, it's just nighttime honey, and then there's melatonin in it, how does your child react to the melatonin? And again, honey is not recommended in less than a year of age. So I think that's the end. I'm gonna do this. So I need to get better on my technology, but it was like not terribly bad. If anybody has questions on cough or cough medications, leave comments here. And I'll be adding this to the website. We're working on switching the website platform over. So I know somebody had said they couldn't get onto the website. But we're working on making that better. So I hope this was helpful. These pictures were from Walgreens last year in the fall, when I was like hiding in the aisle and taking pictures of all of the medications. And so the prices have probably changed since last year. But anyway, I hope this is helpful, and you guys stay safe, and I'll talk to you again soon. Bye.